The symptoms of uterine fibroids, there could be several, and many patients are actually, it's been described as silent sufferers because several women out there have very heavy periods, a lot of pain and cramping. The bleeding could be described as gushing unexpectedly and for a duration that makes some women afraid to even leave their house. Other symptoms could be difficulty holding their urine. There could be constipation, painful intercourse, or just a heavy pressure at all times within the abdomen. These are definitely hormone-sensitive tumors. So women in their 30s and their 40s, when they're still going through their monthly cycles, they definitely tend to develop these tumors. They're definitely completely benign. So this is a very common condition in African American communities, in Hispanic communities, in Asian communities, and over 40% of women over 40 actually have uterine fibroids. Fortunately, only about 20% of those women are symptomatic from them. Some women are referred to me from their gynecologist. In this day and age, a lot of women seem to find us through the internet. We've been developing a center for minimally invasive fibroid therapy, and that predominantly includes two treatment modalities, which is uterine artery embolization and MR-guided focused ultrasound of fibroids. So the first procedure is where we're able to take a small catheter and put it into the artery going to the uterus, which gives blood to the fibroids. Once we're in that artery, we could block the blood supply. Through uterine artery embolization, about 85 to 90% or greater of women are able to avoid surgery and have outcomes that they're extremely pleased with. MRI-focused ultrasound is a completely non-invasive treatment, so it's a very exciting treatment modality where patients are able to lie on the MRI gantry, and I'm able to aim an ultrasound beam through the skin and with pinpoint accuracy to burn the fibroid. So this is an outpatient procedure. There's absolutely nothing put into the body whatsoever, and patients go home the same day and frequently return to work the next day with no incision or scar. Many of these patients instantly by their next cycle, in the next couple of cycles, notice that they've immediately started having a normal short period. We are the only center that offers MR-focused ultrasound in the region. However, not every patient is able to get this treatment because of where their fibroids are located. So in the future, they are making improvements. There is a new machine with improvements in the ultrasound probe coming out in the next couple of years, which is going to allow me to target the beam a little better to avoid other structures. The most important thing to know is there are options to hysterectomy. A lot of women think that that is their option for treatment and are terrified. So these are minimally invasive techniques. These are very healthy arteries. This, for us, is a very straightforward and easy procedure along the spectrum of things that we do, and women are back to their normal feeling of health in about 7 days.